Let's see. Hello, everybody. This is Dr. Kashif Abdullah. Um, I'm just here answering questions again, and if anyone has any questions that they would like to answer or like to ask, they can use the chat box. I will be checking. Say hello, everyone. Let's see. Let's see. So that should work out. Okay. So I have a variety of topics that I'd like to start off with. Well, today is April the 2nd, 2020. We in California and most of the United States and the world are still in a lockdown or social distancing, hopefully still being practiced everywhere. Yesterday we spoke about how social distancing is important in regards to um, essentially creating what's called like a herd immunity. So a vaccination um, for flu shots or what have you, or for measles or what have you, helps create people who are immune to the disease, and when they encounter someone who is infected, they prevent that infected person from that infection doesn't go through them because they can fight it off, and so they don't spread the disease. But in social distancing, it's like an artificial vaccination where we create this wall that prevents the virus from traveling, and hopefully it gets treated at that one specific individual. So let's see. I want to start off with, let me share my screen again, and I will show you what is currently happening in the United States. Let's see now. Now, here you will see that there are approximately almost a million confirmed COVID-19 or coronavirus cases in the world, with 51,000 deaths, unfortunately, and 208,000 recoveries, which is good. Um, and unfortunately, the U.S. has now become the number one. I would like to mention really quick, just before going to the U.S., that the total daily cases is something that I look for, and I'm looking to see this beginning to fall or stabilize. I have not seen a fall, really. We're still going up. There's, I'm hoping that this is maybe a plateau, maybe not, but we're not exponentially rising anymore, hopefully, and so that might be a good thing. But there are new cases, of course. Every day there's new cases, and but there's not an increase in the daily of cases since last time. So that's encouraging. So let's see. It says here the last one they have is March 31st, which was about 2 days ago. It held at 75,000. Before that, it was March 30th, also at 75,000 cases in the world. So maybe stabilization. We'll see. Now, if we go to the U.S., we will see that they have now 235,000 some odd cases, and that is also the combined total of both Italy and Spain together, which is not good. Actually, America has more than them combined. I have a bad feeling that the U.S. will have more cases than Italy, Spain, Germany, and unfortunately, maybe even China combined at one point by the time this is said and done. That's total number of cases. I hope the number of deaths are not that high, obviously, but we stop at 5,607. That's one too many already. That's too many. But you can see here in the epicenter in the United States is New York, and New York City specifically is the real epicenter of the United States where all this is happening, all the deaths are happening, and also all the cases. If we look at the U.S., there is in the daily increase. There was a slight drop. That's a good sign. Always a good sign. At least it didn't go up, but uh, they're still going higher. Let me check real quick if there's any questions. No, there's no real questions there. Anyway, if we look at Italy, let's see what's happening in Italy. Italy is actually unlike the US, has begun to control their numbers. You can see that there is a dip down. There is a dip down between Italy and here, and between the top and the bottom. So they're actually doing what while the U.S. is hoping. This is what the U.S.'s goal is. Um, so the next one, let's look at Spain. Spain, sort of like Italy, is, well, we don't know. Maybe that was a fluke high. We don't know. It's not really dropping down like Italy. But Germany, well, unknown. We have to see the next day's event to really see if this is dropping or increase or staying the same or what have you. China is, well, that's China. I'm not, like I said, I don't really believe the Chinese numbers. It doesn't really look like a proper epidemiologic curve with an increase and then a decrease. It looks haphazard, frankly. Um, France, well, these chart numbers just sort of show that maybe we're coming to a plateau. I don't know if what this is. We need more data in order to smooth out the results. Iran, same thing. They're plateauing, maybe. I don't know. That's a good sign so far. And the United Kingdom, well, they're still increasing. That's not good. Switzerland is unknown. It's just sort of going all over the place. It's maybe plateauing. And then Turkey and what have you. And then I always go to Canada because I'm Canadian. Well, we're in Canada. We're a little. That's not too bad. Yeah, at least it's not. It's plateau or maybe decreasing. We'll see. And I wanted to answer some questions that I had on the WhatsApp. Let me quickly go to the stream. No new questions on the WhatsApp or the. Let's see. So people, I try to answer some topics here. So someone was asking about what happens if the 14-day quarantine is over. Is there a need to retest? What is the process of getting back to normal when is there any normalcy left? Well, after the 14-day quarantine is over, for someone, so here's the thing. The 14-day quarantine is there for those who test positive and have this, and then the mild symptoms have gone away. Then you can have 14 days of quarantine, and usually you need to have 2 consecutive daily tests every day of COVID-19 to see if it's out of their system. And so there is a need to retest. You do need to retest to verify that the virus is totally gone from your system. If you tested positive in the first place, or you showed some kind of symptoms that were concerning and there was not ability to do the test, but you still need a test to verify that you don't have COVID-19. And then someone was asking, and I want to show charts about this. What is the medical community's take on the flattening the curve in California? Are folks seeing a measurable difference on the ground yet? How does the state hospitals compare with other states? And I wanted to talk to you about this, but just before that, that'll take longer. There's one quick question I want to answer, and that's about smell. So there's been recent reports about the idea of a loss of smell and taste being possible symptoms of COVID-19. So in regards to that, I went to the American College or American Academy of Otolaryngologists, basically ENT surgeons, and they're looking into this, of course, and they themselves and other health professions are saying essentially, well, we don't have enough data to say that this is a possible cause or possible symptom of COVID-19, but let's treat it as if it is one. So they're proposing this. This has not been verified by the CDC or other public health departments, or the World Health Organization has not yet said this to my knowledge, but this is a possible new symptom we could use to say, yes, this person has COVID-19, a loss of smell or taste. But in order to bolster that case, the American Academy of ENT Surgeons are essentially telling all doctors, please use this reporting tool so that we can make this case to various health organizations as a possible symptom. So I would I would say, yeah, treat this as a possible symptom as now. It's not verified. We don't have enough data, but you could use it as something to alert your primary care physician and or the emergency room that this is happening. So yes, that is one thing you could look. Now, I wanted to talk to you about also um, the rates. Let me quickly check to see if there's any questions. No new questions. Okay, so the rates. So if you look here, I wanted to show you. Well, we have the United States rate. So let me go back to the U.S. real quick. Let me go up here. So here's the U.S. and here is the number of deaths, and daily increases are slightly decreasing for the U.S. That's good. But if we first compare, I think before we go to the California, let's look at New York. That's the most hard hit. Where is New York? Here it is. So the New York Times has a great website in regards to the COVID-19 issue or coronavirus, and I believe the New York Times is now open to anyone. They have you don't have to pay a subscription to you access their website. That's good. So if you look here, this is basically how to interpret this is the number of cases in New York and where there are in the growth rate. And this is sort of the daily increases I was showing. Remember that thing I was showing you about the daily increase I look at? Well, this is sort of similar. And if you look at New York State as a state, you can see that maybe there is a slowing down of this. Oh, I don't want this. Somebody's calling. Oh, darn. It's a decline for now. So there is a slowing down. You can see there's a slowing down. So that's good. Maybe New York is beginning to get out of under this. And they're the hardest hit. You can see that they have 92,000 cases in New York alone. And the U.S. has like, what, 280? So almost half, not really, but almost a half or maybe 40% of new cases happen in New York alone. And they're beginning to get better. So they're really taking social distancing important, they're really taking it to home. And you can start to see, so if you see the slower cases, so it looks like cases are beginning to slow down across most of the major cities in New York State, which is good. It looks like, I believe these are counties of New York State, I'm sorry. But they're doing what needs to be done. It is by county, I'm sorry. So it looks like New York State in general is getting better at controlling this, which is very important. Now, if we go to L.A. or sorry, California, which was the question was asked, and we look, it's sort of all over the place. You know, it looks like it's in Santa Clara it's getting better. In Los Angeles, it's going up and down. San Francisco is maybe getting better as well. But then there is another website by the Los Angeles Times in regards to tracking coronavirus. And they were showing, and this is actually up to date, this is as of April 2nd. So regarding California numbers, I think this may be more accurate than the New York one, New York Times one. So if you look here, what they're saying is in California alone, there's 10,000 cases. New York, you saw 94,000 cases. California, only 10,000 cases. So and if you look at the number of cases per day, again, does not give you enough. This doesn't help. I don't think this helps you really figure out what's happening. This cumulative cases today, I like this one better. The new cases announced by day. So the number of new cases is what we're looking for when we're looking for a fall. And we're plateauing in the number of new cases. What we want is, if social distancing is working properly, the number of new cases should start dropping as the virus goes on, as social distancing works more, because that means if the number of new cases are falling, that means that the virus is not able to spread effectively between person to person. That's the thing. And this is deaths per day. This is just, a sad fact of what's happening. And we're hoping this also falls too. And who has died? It looks like men have died more frequently, although, it looks like men are much more likely to die from this. And also, more likely the reason is because men usually, as we age, have more comorbidities and more issues than women in general. And those who have usually anyone over 60 has been the likelihood of those who've been passing. So older people of 60. So this is affecting the elderly more than anyone else. These are just the number of deaths again. Again, this doesn't tell us control. So these are the number of confirmed cases. This is just basically where is the disease predominantly being seen. You can see the Santa Clara County here in Northern California, and Los Angeles County and San Diego are the number of cases per se that are the most. But these are just raw numbers, hard numbers. They don't really tell you everything. This sort of tells you where we're at. This actually I like, and I'll tell you why. Okay, this is showing basically the number of new cases per day, and what we want is, what I expect is this to go, so you can see the number of cases. So this is one case, this is more than 5 cases, this is more than 10 cases, 20 cases, more than 200 cases, okay? And so what we're looking for is the color changing from here to, okay, I'll talk that for some later. From here, we want this color, this dark color, to go back to this lighter color. So in Los Angeles, no, we are not moving over, we're not getting better. In Los Angeles, they are still having more and more cases. So if social distancing and preventive measures are working, hopefully we should start to see this get back to this color. Santa Clara County, which is here in Northern California, not as bad as LA, and has half the number of cases, a quarter less than those cases, and half the deaths. That is not as bad as, say, Los Angeles, but we're hoping also that it goes back to the more lighter colors of blue here. San Diego, Orange County, San Mateo, that's also Northern California, San Francisco, all these things. So it looks like, no, things are not getting better yet. Now, I will preface this by saying this. This is about, we are actually, most epidemiologists and most public health officials actually expect this. This is actually normal. I would expect this kind of picture already. It's the number of these dark days right here that I'm hoping get lighter and lighter. So I'm hoping that this will end very soon. That these, and the reason being is because when it was like March the 1st to like the 15th, most people's concern here in the U.S. and the world abroad was not that of coronavirus as much. But now, and because of that, we were not practicing social distancing as much, and by not practicing social distancing, we were infecting more and more people. In the later weeks now, in the 15th to 30th, these people are now, we've started to really hunker down. So the effects of social distancing only happened right about here, when this was happening. So that's why I'm hoping that right about here, because of the effect of the measures that we've been taking, of the not lockdown, but yet stay-at-home orders and all that kind of stuff, that these numbers will begin to get better and better. So yes, California is not as good as actually New York. New York is actually doing a good job. They're beginning to control their numbers. But if you want, you can use the New York Times website for other states. Let's see if I could go to the main one right here. Just go right here. Just literally put in coronavirus in New York. Just put in New York Times and coronavirus. This will pop up, and this will show the various cases in the United States. Of course, the most being right here in New York, and then Louisiana is another hotbed. Detroit and Chicago, and then California here. And one thing I will preface this is the population density in this region is enormous. There's a lot of people that live in that one small part of the country. And in Louisiana, what happened was Mardi Gras. That didn't help a lot. That really spread it there. And Detroit and Chicago is also a heavily densely populated city. Detroit, I guess it's heavily densely. I would say the public health sphere here is very poor. I would attribute more of this to lack of health more than anything else. I would say here, population density, Mardi Gras. Here, poor health, poor public health, poor services, everything. Here again, population density, and then California, population. There is literally almost like 30 some odd million, almost 40 million people living in this one state. So this is the most populous state in the United States. So you would expect this one to have lots of places, and that being said, California is not too bad off compared to New York. Again, because more people are spread out in California than say New York. Um, yeah, this website then allows you to. There's a whole bunch of metrics you can pick up, but I really, really recommend going to this website if you really want to look up this kind of stuff. Let's see what else questions I can ask. Let's see what is the live stream asking me. Is it? Oh, someone's asked me a question. Can you talk about why so many cases pending in California? So many pending cases in California. Well, the likely reason is because I'm actually a little bit confused as what do you mean by pending, quest, pending cases. But I would, if you mean by if there's an outcome versus death versus non-death, just because it takes time. Because I'm a little bit confused with what do you mean by pending cases. So I would, I need a little bit more clarification. But let's continue. What else? Let's see. I'm just looking at. Oh, someone did ask this question. I thought it's sort of an interesting question here. They said, what advice would you have on home quarantining someone? They said their brother is living abroad and is coming home because of the situation, and they want to quarantine him upon arrival out of a caution. So technically, what you're just describing, meaning so what's happening is what this person is describing is someone is coming in from another foreign country and coming into Canada or America, what have you, and their family members don't know if they have. One second, let me decline this one now. I'll talk to them later. They don't know what they have. So let me actually change out the video. 1 second. There we go. So what they're saying is someone's coming in from another country, and they're coming home, and they're concerned about should they, what advice would you have for home quarantining? Actually, you know what? You don't know what that person has, meaning that family member. And out of abundance of caution, I think it's a good idea to quarantine that person. To have them stay at home, in a room, wearing a mask for those 14 days. And technically that's what Canada is doing. Meaning the Canadians, if you're not Canadian, you can't come to Canada, period. Like no non-essential travel can go to Canada, period. Stop. If you're Canadian, that's different. You're a Canadian citizen or a permanent resident, you're allowed back to your home. No Canadian is going to prevent you from coming home. But if you come to if you're Canadian, you come back, you need to be quarantined for 14 days. And if you're not, I don't know if it's the RCMP or the local provincial police that will fine you for $1,000 or what have you. They don't want you to go to the grocery store. They don't want you to go to a restaurant. They want you to go directly to your house. And if you've not done that, especially if you've come overseas, they're going to fine you. How they enforce that, how they determine that, I don't have enough detail about that, so maybe, I'm not sure. So I would say for this person, yes, they should home quarantine. They should quarantine this person in their house for 14 days. If they have no symptoms, good. Keep a mask on, quarantine them, wait 14 days, and then they can come back and do whatever it takes. The reason it takes 14 days is because that is the maximum time that the incubation period will occur for this disease. So there was a great video I shared yesterday from Vox, who stated this about how a flu starts off by getting infected and then having the symptoms literally the next day, and then those next days after that, after showing symptoms, they're just dealing with those symptoms, and that runs its course. So while they're dealing with those symptoms, they're coughing, wheezing, everyone knows, oh, that person's in flu because it's so horrible. Whereas the coronavirus starts one day, and then, meaning you get infected one day, and then 14 days later, the symptoms can arrive of the symptom of the infection. And in those 14 days, you could be totally normal, but at the same time spreading coronavirus to everybody. That's why this is so dangerous, because it's that you get infected, 14 days later, you're just totally fine. You don't know you're infecting people. and you're infecting people, and then oh, now you're sick, now you quarantine or whatever. But you got those 14 days of, oh, I can do anything I want, and you're getting infecting people. And that's why social distancing is trying to remove that aspect. So if someone's coming over from overseas and you don't know anything, they should have those 14 days to see if they have symptoms, because that's how long it takes to incubate. Okay, let's see what else. Let's see what other questions. Let's see. Loss of smell. I've said that. Is a research. Someone was asking about a research paper or what have you. Any thoughts on that? I don't know about the research. I have not. This is something about vaccination. So far, thus yet, we don't have a vaccination for this problem. That's an unfortunate thing. We will likely have a vaccine, I would imagine, unfortunately, maybe by next year. So by then, this will have likely run its course, and it's still beneficial to have a vaccine, but we will likely not have a vaccine yet. So we need social distancing. And again, how long is this going to take? Well, I don't know really. I would say if we go to the US, let me go right here again. If we go to the US, they've got the most number of cases, so they're going to take the longest. My personal opinion is the world will likely, if you use South Korea as an example, as an example of a country that's done it right, I would say South Korea will be out of the COVID-19 issue by, they'll be literally back to normal, or whatever normal is right now with the rest of the world like this, but they as a country will be back to normal or larger degree maybe by even the end of this month. They should be fine. Look at them. They've really done what's supposed to be done. The rest of the world, but I would imagine that they will likely not allow anyone into their country while this is happening, because the rest of the world is ravaging with this. So I would imagine that most of the world hopefully will be done with this by, now this is a guess, by June. And America a little bit after, maybe July, maybe August. And the reason I'm saying that is because of where is the peak of these incidences. We don't see the peak yet. We're still right about here. So we'll see. It's coming up to the end of the hour now, at about 1 o'clock. Let me give me a couple seconds here. I'm going to switch something. But yeah, sorry. So we're coming up to the end of the hour, and we'll just taking it day by day. If you have any questions or anything you want to address, please feel free to. I'll leave questions on the. Looks like someone was asking questions here real quick. Let me see if I can ask them really quick just before I sign off. I read on CNN that there are 50,000 tests in backlog. What do you think is the reason why California numbers are so low? I'm not even sure what that even means. There's another thing. Will you say Sam Stephen is a Hmong? I don't know what that really means. Okay, Sam Stewart is a Hmong. What? Okay. Okay. So why is there such a backlog? I don't know why there's such a backlog. 50,000. I would just say one of the reasons maybe because many people are concerned for COVID-19 and are staying home. That's the reason. Maybe it's just processing time because people are just so overwhelmed with stuff. So we're basically come to the end. This is Dr. Abdullah signing out. If you have any questions, please feel free to leave them, direct message me or what have you. Not that many people ask me questions, so I can still do that. But I try to be here like every Monday to Friday from 12:30 to 1 o'clock. Feel free to ask me any questions you wish. Thank you very much. Bye-bye.